Continue the conversation on the release of that report of Tower Hospital in the Eastern Cape. And of course, Professor Malegapuru saying earlier on in the day that certainly the situation there cannot be compared to the life esidimeni crisis in Gauteng. He joins us now further. Prof, before I go any further, you heard what Bernadette Maguire had to say there in terms of her initial impressions of your findings, and it's a sentiment that was expressed, I think, by quite a number of reporters in the room who had travelled to the Eastern Cape. Some of them had travelled from the Eastern Cape, who couldn't understand how you came to your findings.
Well, I came to my findings through systematic evidence that is based on scientific information that I received following the complaint. I actually sent my investigators there, who are all senior nursing staff, to go and investigate and do exactly what these investigators are doing. Remember that I'm a medical scientist. These are journalists. I understand the health profession and how it operates much better and in much greater details than journalists who go there and sometimes talk to anonymous sources, and those anonymous sources may have their other agendas. I don't know about that. But all I'm saying is what came out of my investigation shows that the basis of what was being peddled in the media is completely false. Now, here is the bottom line. The man who was the star of this peddling of stories is Dr. Kerry. He wrote the articles and collaborated with the journalists in the media. He appeared on Checkpoint as one of the people there. He then, after he was confronted by the investigators from the Office of Health Standards and Compliance, admitted that his figures were wrong. And they were not only wrong by a small margin, they were wrong by a figure of 22, which is about 32%. Now, when they took him through that, he was startled. He said, no, it can't be. It's because I had used a financial year instead of a calendar year. They took him through on a manual count of the two available death registers. He came to a figure of 73. Then he said, but I told the journalists that the figure was 86. They said, how did you come to the figure of 86? He says, oh, I'm sorry. I made a mistake because I changed the figure 6 in front of the, instead of being 68, I made it 86.
And Prof, from what we understand, even the official figure that was given by the department officials in the Eastern Cape, even that turned out to be incorrect too.
Yes, but I will come to that. I've never sanctioned that was actually, something that was correct. But remember that the official figure that was given by the department happened after the death register had disappeared, and that death register was in Dr. Kerry's office without authorization of it supposing to be there. So they had to now cobble around figures based on what the wards could tell them. And as soon as they got the death register, they went and apologized instantly. Now, when Dr. Kerry was made aware that his figures was wrong, he did not apologize. He kept quiet until I came there 2 months after he had known, and then he admitted again, and I said to him, what are you going to do? He never apologized. He said he was going to write to the press ombuds. He did not write to the press ombuds until a month after, when I was reminding him, I need some way in which I can explain how you arrived at the figure. Then he wrote to the national minister to say, I'm very sorry, my figures were wrong. He copied that to me. So you have, as I say, your primary source saying what I did was false, exaggerated, and wrong.
Well, I think one of the primary sources, to be fair, Prof, because many of the journalists did not just speak to him alone, and certainly the scope and the extent of your investigation says as much, but we'll get into the actual content in a moment. So where Dr. Kerry is concerned, I think you've made it pretty clear that he's violated part of his oath and he needs to be investigated.
Let me make it absolutely clear. The thing that has damaged the reputation of people, the thing that is etched in the minds of the public, is the figure of 90 of death that occurred in there. Internationally, we are known as a country where 90 people have died without actually doing simple statistical analysis. The whole thing about this is like another life is demanded that came from Checkpoint is based on that fallacy. And we cannot make the truth out of lies. We cannot build a society of respectable people by peddling lies, even through the media. I think we need to respect the truth rather than say a whistleblower must be respected for telling us lies and
Absolutely.
for being unethical.
Absolutely.
This is what happened in this case, and Dr. Sukeri is the primary source of what else came about in this matter.
So in terms of the remedy that you have suggested, do you think that it goes far enough in dealing with that? Because, of course, there are concerns that it may be too harsh to the extent that others who experience difficulties in the Department of Health or within the medical profession will then not even be willing to engage on some of the issues that they face as a result.
This is a very simple request. All of us as doctors, we are allowed to advocate. All of us. Advocacy is a feature of medicine. You are supposed to advocate. What you cannot advocate for, you cannot advocate by breaking medical ethics. You cannot advocate by breaking patients' confidentiality. You cannot advocate by telling lies and not respecting the truth. You cannot advocate by lacking integrity in your advocacy. This is what happened here. So I am not against advocacy. You must respect the truth. You must have integrity. You must be ethical. You must follow the processes. Dr. Sukeri admitted that he did not follow the processes that were available to him within the system. And he said, in his own words, this was a serious mistake that I made. I quote him because it's on record.
All right, and certainly I think your recommendations address part of that. But for me, Prof, the other, I was asking whether or not
they are not harsh.
Okay.
This is what you do to a doctor when they have committed a misconduct. You report them to the Health Professional Council. The Health Professional Council has committees. Those committees will discuss what you have actually provided them, and they will come to a conclusion. That conclusion may be separate and different from what conclusions you have come to. And that's how the process regulates itself. You don't assume that you are right all the time, but it's like dealing with fraud.
Yeah, and certainly, although he may have gone about it the wrong way, we're having this discussion now about mental health in the Eastern Cape. And I think the real story, too, of these findings is what you've been able to cover within the Eastern Cape Department of Health. And it seems that it is absolutely shambolic.
I can't disagree with you. It is shambolic, and I've listed all those defects. And I have actually, can you imagine that you have a department where the Ombudsman recommended there must be an administrator? That must be a very serious recommendation. It cannot be that it's business as usual. I've recommended that there is an administrator is appointed, but more importantly, I have given that administrator tasks that are related to my findings that must be corrected. There's no doubt that this has gone on for too long, I think, in the Eastern Cape Department of Health, and it needs to be corrected.
Let's look at part of what exactly you've said they've failed to do. Yes. This is over and above the fact that they failed to just prioritize mental health over a long period. But you point to systemic failures, you point to infrastructure failures, treating specialists, even the people that they work with, in a way that disregards their professionalism and the fact that they deserve to be where they are.
Yes, I think that was actually a doctor by the name of Mo Nagdi, who provided a detailed problem of the relationship between the department and the specialists in that province. And I found his arguments compelling. I've actually used it as one of my annexures in the report. to say that in order to operate in the best interest of mental health people, that this relationship issue has to be resolved, and it's a major issue because the people who deliver the service is not the people sitting in Bisho, it's the people, it's the specialists that are in the hospital, and that they must be treated with respect. I make that unambiguously clear. I also make Dr. Sukeri's recommendations about what should happen to mental health in the Eastern Cape. He gave me 4 or 3 recommendations that I've included as part of my overall recommendation about what should happen in the department. So I did not ignore what he said, because I know that this has been his passion.
And when we look at the problem where Tower Hospital is concerned and the seclusion rooms, what actually happens there?
Look, let me put it this way. All mental health hospitals in the country have a seclusion room. And in fact, in modern society, the use of seclusion room is actually a human rights issue. Every of the 34 witnesses that I interviewed agreed on that. Everyone who has gone there have agreed on that. And in fact, you will be glad to know that one of my first recommendations is that this have to be dealt with. As I speak to you today, those rooms have been replaced. They are very different today, and I urge the journalists to go and see them for themselves. So something is being done.
Yes, but prior to your intervention, what would happen in those seclusion rooms?
Well, people would be kept there as a form of detention, sometimes as a form of punishment, because maybe they were disruptive to other patients that they were with. So it was a way of isolating disruptive and sometimes very psychotic patients to go and isolate them and put them in that detention. Now, there is obviously a regulation of how long you can detain people there. Sometimes they are kept within that period, and other times they are kept longer, and that's where the problem comes. Now, Dr. Sukeri was part of the doctors that practiced that. So he is not innocent in the use of those so-called seclusion rooms.
Where has the, and I was really trying to stay away from the two issues here, but there is an insinuation, at least from the journalists that have been covering the story for a while, that the fact that he decided to, come out publicly was perhaps the reason why there's been this, what's seen as a fallout between him and the department.
Well, I don't know. I wasn't supposed to investigate that. All I did was, remember, I didn't invite myself to investigate. I was here in Pretoria, I was asked to come and investigate. What is more important is this. I was given a complaint by Dr. Sukeri. I went through that complaint line by line with him and asked him, what is this based on? It's based on an opinion. What is your opinion based on? He couldn't answer me. He couldn't provide me almost without exception, any evidence that he had done of scientific nature. Remember, this is a medical scientist that I could actually trust and say, yes, he has done some homework, he has done some little bit of studies. There was none of that. It was just his opinion.
All right, Prof. Unfortunately, we've run out of time for this interview tonight, and we'll certainly be looking to see at the advancements that are made following your recommendation for an administrator within the Eastern Cape Health Department. That he's given the minister 90 days to appoint this administrator who will then oversee the provision of mental health services in that province.